Red Cross delivers services right across Northern Ireland. Those services are provided by hundreds of volunteers. Every year they're delivered to thousands of people who are recovering from a health or social care crisis. So the service will be round the corner from wherever you are in Northern Ireland at any time. Our offer includes standalone services such as our wheelchair loan across Northern Ireland, or our comprehensive package of care in the home services, which are focused on people who need to either maintain their independence or to regain it. Those services are designed to enable people to either return home from hospital sooner than they otherwise would, or to prevent unnecessary hospital admission or admission to residential care. Through emergency response, we work with local councils, with emergency services, with the local health and social care trusts to assist in major emergencies such as severe weather, flooding and so on. Our Land Rovers are able to transport health professionals to isolated people in areas where they may be cut off by bad weather, and that increases their vulnerability.
We would use the British Red Cross care in the home following discharge and plan for discharge for patients from a hospital setting.
I'd been in a hospital for quite a while, and I had just recently lost my husband before that, so it was kind of like as if all my props had been pulled away, you know. I sort of lost confidence in myself, being able to get out. Red Cross sent me somebody along, took me to the post office and down to the bank, and we had a cup of coffee sometimes. It was really wonderful.
Our volunteers are very carefully selected, and our service would then work with the service user to see what kind of support would really make a difference to them, to help them to regain their confidence and improve their health.
With June, she enjoyed getting out and about, so we would do our messages, our post office, doctors, things like that, and then we always went off somewhere nice for a coffee, and she just enjoyed getting out, going different places, meeting with different people.
Unless these people are there, you're on your own, and it's so great having somebody to help you. I think she deserves to get a knighthood.
I just think it's nice to give something back, and there is a lot of people out there who just need a wee bit of help, and I do have that bit of time and I really enjoy it, and I do get a lot out of it.
I certainly feel that we could recommend this service to a wide variety of people, both those in the community setting and those who are working in other hospitals across Northern Ireland. We've found it very beneficial resource and valuable service to our clients and service users.
The key thing to remember about Red Cross services is they're very much personalised to the needs of the individual. So that may be one or two small but very significant things, like help to get out of the house to go to medical appointments, maybe to help people to start doing their own shopping again, or things like that.
I was asked to go to the clinic, and when I went there they wanted me to come to physio for a week, and I had no way to get in there. It was Eileen that came every Monday, and then I went out at 12 and she brought me home, put me right through the door. She wouldn't even let me walk from the car to the door. I couldn't have went for my physio and all, only for having that service.
We help people in crisis, whoever, wherever they are, and we will respond depending on what their needs.
The service basically that we commission from Red Cross is wheelchair loan. We have found it to be an excellent service. It's very flexible. It is run by volunteers, which is brilliant. They're very highly trained. They have a great range of wheelchairs. It's a very good service, very appreciated by people.
I was in the Royal Victoria Hospital for 2 months. I had a car accident. I needed a wheelchair to get home again. At that time, I wasn't going home until I had one, because I wouldn't have been allowed out of the hospital until you had some proper way of getting home again. The only part of the limb I had that was moving was my right arm, and that it had to be a wheelchair that you could work without your two arms. So it was a specialised wheelchair. I thought, well, this is brilliant, that they can get one, and they never asked me to bring it back until I had finished with it. So I was really happy. Thank you very much. Give me life again, and help me never forget it. Like, it really helped my life anyway.
People recognise that the Red Cross is there to help people in crisis, whoever and wherever they are. And we are doing that throughout the world. And we are all committed to changing people's lives for the better.